Hey, Lori, thanks so much. Well, Chet Burrell is with me now, and one of the things we were talking about is the expansion under the healthcare plan. You guys insure about 3.5 million people. You're the largest insurer in the Mid-Atlantic, and we should point out you're a nonprofit. But what stands to happen in terms of the number of people you cover as a result of this bill?
It should go up.
About how much?
Well, let me put it in perspective. There are about 1.1 million people in this region, Northern Virginia, Maryland, and D.C., that don't have coverage at all today. So some portion of that will actually seek coverage here. Let's say the majority. We today have a 45% market share. So if we were to get 45% of those that are uninsured, that would be pretty big growth.
One of the things that we have seen from the Obama administration is a lot of focus on insurers, a lot of demonization, some people have called it, of insurers. Do you think that's fair? Do you think you all have been unfairly targeted? After all, you're going to be gaining customers under this.
I think some of it is well-founded, and some of it maybe is a little too extreme. Especially for us as a nonprofit, our whole goal is to get as to many people as possible to cover them as affordably as possible. And we make 1% a year maybe, or break even. The goal is not to make a profit, it's to make it affordable. The reason we think the focus needs to be on the underlying healthcare costs is that a lot of reform deals with insurance reform, but healthcare costs themselves are rising fast enough to make it unaffordable for many employers and for many individuals. In this region, it's a good example. We have seen small employer groups go to high deductible health plans basically by shifting deductible cost to their employees and dependents. I don't think because they wanted to, but because they felt they had to. And now the majority of small employers are offering high deductible plans.
Let's talk about premium rates, because you all had a 35% increase in one of your markets that was denied by the rate insurers, or the rate agency here in D.C. What do you think is going to happen to healthcare premiums overall after this bill?
Well, on that particular one, they had approved it, and it was for a very small product with very small enrollment. And what happens when you have small enrollment is you can get a spike. The rule under the law was that you have to have the premium be sufficient to cover the cost. What we agreed to do was to pool it together with larger populations of people, and it brought it down to 12%. We would have done that, but the state precluded us in advance.
And under the bill overall, what happens?
We're worried about it overall, because here's what we think could happen. People are required to get coverage, but there's a very small penalty if you don't get coverage. Benefits need to be enriched, and if the good risks stay away, the young, healthy people, and only the people who need the coverage get the coverage, they will spiral up out of control, and that makes it less affordable for everyone.
Well, we're going to have to wrap it there. We got to go to break, but a lot of questions about implementation as this bill goes forward. We're going to send it back to you guys in New York.